As colder temperatures approach, parents may worry that their child might catch the common cold or flu, but many parents don't know about another contagious and common virus that's contracted by nearly all infants by the age of 2. It's called Respiratory Syncytial Virus, or RSV, and it's the leading cause of hospitalization for infants in the U.S. during their first year of life. Joining us now are actress and TV personality Vanessa Lachey, who, among other things, was the co-host of the 2007 Miss Universe Pageant in Mexico City. She's a mother of 3 who has experienced the severity of RSV firsthand. And with her is Dr. Michael Flores, a pediatric and adolescent intensive care specialist from Akron Children's Hospital. So I'm delighted to be talking to both of you today.
Thank you so much for talking with us. We're as delighted as well.
Thank you for having us.
Dr. Forbes.
Yes.
What is RSV, and why is it something that parents should look out for this time of year?
Sure. Thanks again for the opportunity to share and educate about this problem. RSV is a very common, highly contagious virus that creates an epidemic every year, typically between November all the way out to March. Season to season, and depending on where you are in the United States, the season may be a little bit different, but it's very predictable, and it happens every year. As you mentioned, every child roughly up to the age of 2 has already been infected. So everyone in your listening audience, all of us have all had RSV at least once. It turns out for most people it just produces symptoms of the common cold. But in high-risk infants, particularly those born preterm, less than 36 weeks, it can become a much more serious infection, resulting in hospitalizations or even worse.
Okay, so almost everybody gets it. Almost every young person gets it.
Yes.
Okay. And Vanessa, can you tell us your story about your son's experience with RSV?
Yes, I can. And it was so, when you did the introduction, I giggled because you said 2007 host, and I thought, man, that was like 10, 11 years ago. I feel like the old lady up here who's done so much. But what I'm most proud of are my 3 kids, and our youngest is Phoenix. He's 1 now, but he was born at 30 weeks. And to Dr. Forbes' point, since he is a preemie, he's a high-risk baby. And yes, pretty much all kids 2 and under will come in contact with RSV, but those high-risk babies have a different reaction to it, and it's definitely more severe, which I saw firsthand with our son Phoenix. When he got RSV, the symptoms escalated very quickly, and he ended up in the PICU for 6 days on a breathing machine, and it was hands down, as a mother, the most terrifying moment in my life. And I don't ever want to see parents have to go through that, and it's why I'm here today, sitting here next to Dr. Forbes, and we've partnered with AstraZeneca because we want to make people aware and empower them with knowledge on what RSV is, why it's important and critical to help prevent it, because there is no treatment for RSV at this moment.
I see. So if there's no treatment, so what were you able to do when your son got it?
Well, at that point, he was already, his oxygen saturation level was in the 70s, which, I mean, I was talking to Dr. Forbes earlier, below that, you're code blue, and we're incubation and potentially losing him. In fact, RSV is the highest infant death rate, more than the flu in babies 1 and under. And so at that point, I just had to get his oxygen saturation level up and continue breathing and trying to go through the rehab process. But before that, it's about understanding it. Go to rsvprotection.com. I'm so sorry, I'm getting choked up talking about it. And understand what it is and help try to prevent it, because every year between November and March, it is an epidemic, and we need to do everything we can to truly understand what this virus is and how we can prevent it with simply washing our hands with antibacterial soap, changing our clothes and bedding, antibacterial wipes on toys, and just being more aware of talking about it with our pediatricians and healthcare providers. Having the conversation, what is RSV? Is my baby high risk? What can I do in this situation?
And Dr. Forbes, what's the difference between the RSV symptoms and the flu symptoms?
Terrific question, because At the very beginning, they're indistinguishable. They look exactly the same. The difference is in high-risk patients and in patients who are in that high-risk group, it can become a much more serious, life-changing or even life-threatening infection because of their inability to fight infection. And so it starts very similar, again, upper respiratory type symptoms, but it can rapidly progress to lower respiratory disease and even worse.
I see. All right. And why are premature babies more at risk?
That's also another great question. So we know that preterm babies are up to 5 times more likely to be hospitalized due to RSV in the first 6 months of life. And why is that, to your question? We know that their lungs are immature. We know that their immune systems are also underdeveloped. The combination of those 2 factors makes preterm babies high risk. Once they encounter RSV, they are more likely to develop severe disease, become hospitalized, frankly, or even worse.
Okay, and Vanessa, what advice would you give parents to help protect their children from RSV?
I think I want to encourage them to learn as much as they can and talk to their pediatricians and healthcare providers, make it a conversation. And again, check out the website if they can at rsvprotection.com.
Slow down. Let's be sure our audience gets that.
Sure.
It's RSV
Protection. Yes, ma'am. And it's one word, rsvprotection.com. And they can read up about this virus and also ways to help prevent it.
Okay, that's very helpful. Well, I want to thank both of you for sharing this information with my Health Power audience. I'm sure it will be helpful for them. And Vanessa, I mentioned Miss Universe Pageant because it's such a well-known entity, but certainly you have had many more starring roles.
No, it was exciting because I remember that pageant, and I was dating my now husband, and we were pre-kids, so it was a fun time. We were traveling, and now it's all about the kids, and I'm on to that next chapter, and it's fun to relive the things I've done. So thank you for bringing that up.
Okay, and let me thank both of you, and have a good day.
Thank you. You as well.
All right.